pressure is very complex. Most people don't realize that. They just think that it involves your heart and your arteries, but that's not the case. Almost every organ in your body has something to do with your blood pressure, including your kidneys. Your kidneys are very associated with your blood pressure, your lungs, your adrenal glands. There is a whole cascade of hormones that detect what your blood pressure is. You've got receptors all over your body. You've got receptors in your carotid arteries. You've got receptors in your kidneys that determine what your blood pressure is, and they make adjustments. So, several parts of your body all day long are figuring out, is your blood pressure too high or too low? And those are the mechanisms that will either increase your blood vessels, decrease your blood vessels, retain fluid, get rid of fluid, yeah, breathe out more carbon dioxide. So, all of these organs that I just mentioned play a role in a patient's blood pressure. So, if you have a condition in any one of those organs, you may have a harder time managing or controlling your blood pressure. We have all kinds of things that we can do in healthcare as your healthcare providers to help you manage blood pressure, because it can be difficult to manage. Obviously, we want people to lose weight and reduce their stress and not smoke and not drink and do all of those things that we know contributes to high blood pressure, eating healthy, reducing sodium. But we also have a lot of other medications that we can offer. You might hear your provider saying that we're going to put you on an ACE or an ARB or a blocker, a beta blocker, or a diuretic. These are words that we use in healthcare to determine where in that cascade system would be best to manage your blood pressure. Do we have to block something at the kidney level? Do we have to remove fluid, from the vessels? So these are things that you can discuss with your provider, which is another reason why every single person in America needs to have a primary care provider, because these are the kinds of things that you would discuss and manage with a provider. So if you go in for your annual well visit, and everybody should have one every year, and it's determined that you have high blood pressure, your provider may start one of these medications. And then, if that doesn't work for you, for example, if we put you on one of the medications that blocks one of the functions in the lungs, you might develop a cough. That's a fairly common side effect. Okay, now your provider knows that. We can stop that medication and try something different in order to manage your blood pressure. Because if we can manage your blood pressure and keep that blood pressure under control, now we've reduced your risk. And so, long term risks of blood pressure, as we know, are heart attack and stroke. But if we can mitigate those risks, we can improve your health and help you live a much longer life. Therefore, you need a primary care provider. And I'd recommend Associates in Primary Care if you don't have one.